Doctors warn, top 6 dangerous fruits for seniors to avoid. Hello everyone, especially our beloved grandparents and parents. Have you ever thought that fruits, the food everyone says is good for your health, could actually pose a hidden risk for seniors? Today, we're about to reveal a surprising truth you might not have heard before. While fruits are an essential part of a healthy diet, not all fruits are safe for older adults. If you or a loved one are dealing with diabetes, kidney disease, or heart problems, some fruits that seem harmless can actually cause serious harm. From raising blood sugar levels and damaging the kidneys to causing choking, these issues can occur if the wrong fruits are chosen. In this video, doctors will warn you about the 6 dangerous fruits seniors should avoid to protect their health. These fruits can affect your health even if you feel perfectly fine. You might be eating them every day, unaware that they're silently causing harm. Discover these dangerous fruits today, and be sure to stay tuned until the end of the video for safe alternatives that will help you maintain your health without worrying about hidden risks. Share this video with your family and loved ones so they can better understand the potential health risks from certain fruits. And remember, before making any changes to your diet, don't forget to consult with your doctor to ensure long-term health protection. 1. Star fruit, K, and its risks for seniors. Star fruit, or K, is an attractive tropical fruit with a star-like shape, bright yellow color, and a unique sweet tart flavor. It's widely enjoyed in tropical markets and loved by many for its refreshing taste and high vitamin C content. However, for seniors, especially those with kidney issues, star fruit can pose serious health risks that you may not be aware of. Star fruit contains a compound called carboxin, a natural toxin that can harm the kidneys. In a healthy body, the kidneys function properly to eliminate toxins effectively. However, as we age, kidney function declines, making it more difficult to filter out toxins like carboxin. This results in the accumulation of carboxin in the body, leading to serious symptoms that older adults may not immediately recognize. Common symptoms of carboxin buildup include dizziness, confusion, chronic fatigue, and even coma. These symptoms can easily be mistaken for other health issues, leading individuals to not realize the hidden dangers of consuming star fruit. When the kidneys cannot clear carboxin, it can lead to kidney poisoning and damage to the nervous system. For those with chronic kidney disease, consuming star fruit can accelerate the progression of the condition, causing acute kidney failure and other serious health problems. Many seniors are unaware that a seemingly harmless fruit can have such a detrimental effect on their health. Therefore, if you or a loved one have a history of kidney issues, avoid star fruit and consult your doctor about safer fruit options. By choosing the right fruits for your health condition, seniors can enjoy the nutritional benefits of fruit without worrying about hidden risks. 2. Grapes and their risks for seniors. Grapes are a popular fruit known for their sweet taste and convenience. However, for seniors, especially those with diabetes or pre-diabetes, grapes can pose unexpected dangers that shouldn't be overlooked. The high natural sugar content in grapes is one of the main concerns. While grapes contain natural sugar, for seniors, particularly those with diabetes or a history of diabetes, this sugar can cause a rapid spike in blood sugar levels. When blood sugar levels rise too quickly, the body has to work harder to stabilize, leading to symptoms such as fatigue, shortness of breath, constant thirst, and long-term complications, such as cardiovascular and vision problems. This is especially dangerous for seniors who don't realize that eating a small bunch of grapes could lead to these side effects, which may not be immediately noticeable. Small changes in diet can make it harder to control diabetes, increasing the risk of complications and lowering the quality of life for those affected. Additionally, another concern with grapes is their size and texture. Grapes are small, soft, and slippery, which increases the risk of choking, particularly for seniors who have weakened swallowing reflexes. When seniors eat grapes without chewing them properly or swallowing a whole grape, it can easily get stuck in the throat, blocking the airway. While a younger person might be able to cough it out easily, for an older adult, especially those with weakened health and slower reflexes, this can result in a serious choking hazard, potentially requiring emergency intervention. So, if you are a senior or have a loved one with diabetes or swallowing issues, be cautious when consuming grapes. Cut grapes into smaller pieces. Or, opt for safer fruit alternatives to reduce health risks. Always consult your doctor before making changes to your diet to ensure your health remains safe. 3. Oranges and their risks for seniors. Oranges, with their distinctive sweet and sour taste and abundant vitamin C, have long been considered one of the healthiest and most nutritious fruits. However, for seniors, oranges pose several risks that may not be immediately obvious. Especially for those with stomach issues, acid reflux, or those taking medications, oranges can have negative effects that shouldn't be ignored. One serious problem oranges can cause for seniors is stomach irritation. Oranges contain a high amount of citric acid, and when consumed in large quantities, they can lead to acid reflux, GERD, gastroesophageal reflux disease. Acid reflux occurs when stomach acid flows back into the esophagus, causing symptoms like burning pain, heartburn, and even difficulty swallowing. For seniors, this is a common issue, and consuming oranges only worsens this condition, making them feel uncomfortable and fatigued. These symptoms can significantly reduce the quality of life for seniors, making daily activities more difficult. Additionally, oranges can affect the effectiveness of certain medications that seniors may be taking. Oranges can interfere with the absorption of blood pressure and antidepressant medications, rendering them less effective. This is extremely dangerous because if blood pressure medication isn't absorbed properly, it can lead to high blood pressure. Or if antidepressants aren't working, it can result in increased fatigue and depression returning, negatively impacting both mental and physical health. Another issue with oranges is their impact on tooth enamel. Due to their high acidity, oranges can wear down tooth enamel, making the teeth weaker and more susceptible to cavities. For seniors whose enamel has already weakened over time, regular exposure to acidic foods like oranges can cause tooth sensitivity, pain, and cavities. Therefore, seniors should be cautious when consuming oranges, especially if they have stomach issues or are on medication. Instead of eating whole oranges, try diluting orange juice with some water to reduce acidity. If you have any concerns about eating oranges or other fruits, consult with your doctor for specific advice to ensure the best protection for your health. 4. Avocados and their risks for seniors. Avocados are a popular fruit known for their high content of healthy fats and rich nutritional profile, often recommended in healthy diets. However, for seniors, consuming avocados can lead to unintended consequences, especially when consumed in excess or when they don't align with one's health condition. One of the main concerns is the high calorie content in avocados. While avocados are rich in monounsaturated fats, which are good for heart health, the high calorie content can lead to unwanted weight gain for seniors. As we age, our metabolism naturally slows down, meaning our bodies don't burn calories as efficiently as they once did. Eating too many avocados can increase daily calorie intake without burning them off, leading to weight gain and related issues such as diabetes and high cholesterol. This can negatively affect seniors' health, increasing the risk of chronic diseases like heart disease and stroke. Additionally, avocados can cause side effects when combined with certain medications. For seniors taking blood thinners like warfarin, avocados can interfere with the medication's effectiveness. Avocados are high in vitamin K, which is essential for blood clotting. While vitamin K is important for the body, consuming too much, especially while on blood thinners, can reduce the effectiveness of the medication, increasing the risk of blood clots. This can lead to a stroke or vascular accidents, which can have serious consequences for seniors. Therefore, while avocados are nutrient-rich, seniors should exercise caution when consuming them. Portion control is critical to avoid unwanted health risks. If you or a loved one are taking blood thinners or have issues with weight management or metabolism, consult with your doctor before adding avocados to your daily diet. Your doctor can help you determine the right amount of avocado to maintain health without causing weight gain or medication interactions. 5. Watermelon and its risks for seniors. Watermelon is a refreshing, sweet fruit that's easy to eat and often favored in summer for its high water content, which helps hydrate and cool the body. However, for seniors, especially those with heart disease, kidney problems, or diabetes, watermelon can carry unexpected risks. One concern is its high water content. While hydration is essential for life, for seniors, especially those with heart or kidney issues, consuming watermelon can cause the body to retain water. When the body can't effectively eliminate excess fluid, it can lead to swelling, edema, in the feet, hands, or face. This puts extra pressure on internal organs, particularly the heart and kidneys, leading to inefficient circulation and potential breathing difficulties, making it uncomfortable and exhausting for older adults. Moreover, watermelon has a high glycemic index, meaning it can raise blood sugar levels quickly, which is dangerous for individuals with diabetes. Eating watermelon causes a rapid spike in blood sugar, requiring the body to work harder to process it. For seniors, this could lead to symptoms like fatigue, shortness of breath, and a general feeling of sluggishness. If this continues, it can impair the ability to control blood sugar, leading to severe complications such as heart disease, kidney disease, or even vision loss. Furthermore, watermelon is high in potassium, a mineral essential for the body, but consuming too much potassium, especially for those with kidney problems, can lead to hyperkalemia, high potassium levels in the blood. This can cause heart rhythm disturbances, muscle weakness, and in severe cases, heart failure. So, while watermelon is a delicious and nutritious fruit, seniors, especially those with heart, kidney, or diabetes, should be cautious when eating it. If you want to continue enjoying watermelon, eat it in moderation and keep an eye on how your body reacts. Always consult your doctor before adding watermelon to your diet, especially if you have any health conditions related to the issues mentioned above. 6. Papayas and their risks for seniors. Papayas are a tropical fruit that many people enjoy for their sweet taste and rich nutritional content, especially vitamin C and digestive enzymes. However, for seniors, particularly those who are taking diabetes medication or blood thinners, papayas can pose unexpected risks. One of the biggest issues with consuming papayas is their potential to interact with medications. Papayas contain an enzyme called papain, which can affect how the body absorbs and processes certain medications. Specifically, for seniors taking blood thinners like warfarin, the papain in papayas can increase the effects of the medication, leading to the risk of excessive bleeding. If you're on blood thinners, eating papayas could make it harder to control blood clotting, increasing the risk of abnormal bleeding or even a stroke. Additionally, for seniors with diabetes, papayas can interfere with the effectiveness of diabetes medications. The papain in papayas can alter how these medications are metabolized, reducing their effectiveness and making it harder for individuals to control their blood sugar levels. This can lead to severe complications, including rapid blood sugar spikes or hypoglycemia, low blood sugar, which can cause fatigue, nausea, and headaches. Another concern is that papayas can trigger allergic reactions in individuals who are sensitive to latex. Papayas contain proteins similar to those in latex, and for those with a latex allergy, consuming papayas can cause allergic reactions such as itching, swelling, shortness of breath, and in some severe cases, life-threatening reactions. Therefore, while papayas are a nutrient-dense fruit, seniors, especially those on medications or with a latex allergy, should be cautious when consuming them. To ensure safety, it is best to consult with your doctor before incorporating papayas into your diet, especially if you're managing conditions like diabetes or using blood thinners. Your doctor can help determine whether papayas are suitable for your health condition. 7. Tips for seniors when choosing foods. As we age, our bodies change, and our ability to digest and absorb nutrients isn't what it used to be. For seniors with health conditions like diabetes, kidney disease, heart disease, or other chronic issues, food choices must be made with great care. Some fruits that seem harmless can actually cause serious harm if consumed improperly. First, seniors should closely monitor their bodies after eating new fruits or foods. We can't always rely on how we feel initially, as health issues may not show up immediately. Pay attention to symptoms like stomach pain, indigestion, fatigue, nausea, or dizziness after eating to quickly notice if a food is not agreeing with you. If you experience any abnormal symptoms, stop eating immediately and consult your doctor. Second, always consult your doctor before making changes to your diet. Seniors often have underlying health conditions, and certain foods can interact with medications differently. For example, those taking blood thinners or diabetes medications should avoid fruits that may decrease or increase the effectiveness of their medications. Fruits like star fruit, watermelon, grapes, or avocados can affect health if consumed improperly. Your doctor will help you create a balanced diet based on your current health status. Third, portion control is crucial. While fruits are great for health, seniors should eat them in moderation, especially those with high natural sugars or strong acidity. Overeating can lead to blood sugar spikes, digestive issues, or swelling, especially for those with heart or kidney problems. Eating fruits in moderation will help your body absorb nutrients without unwanted side effects. Lastly, always choose fresh, clean fruits. Wash them thoroughly before eating and prioritize fruits that are lower in sugar or easier to digest, like cucumbers, peaches, or melon. Don't forget that health is your most valuable asset, and proper care of your diet will help seniors live a long, healthy, and happy life. We've just discovered 6 fruits that can harm seniors if not consumed carefully. But don't worry, you can take charge of your health right now. Changing your eating habits not only helps you avoid hidden risks, but also maintains good health and energy as you age. Don't hesitate any longer. Take action today to protect yourself and your loved ones. Reduce risks, protect your health. This is something you can do immediately by replacing dangerous fruits like star fruit, grapes, oranges, avocados, watermelon, and papayas with safer alternatives. Consult your doctor, track your health regularly, and adjust your diet to fit your body's needs. Remember, every day you delay is a lost opportunity to safeguard your health. Act today, because health is something you can't buy back once it's gone. Share this video with your family and friends so everyone can become aware of the potential risks and make the right changes for better health. Start confidently today. You deserve a healthy and joyful life. Together, we can create a long, energetic, and strong life. Don't let carelessness in your diet diminish your quality of life. Protect your health. Act now.